Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. You can also make use of it. Now in the last class we were discussing about nephrotic syndrome. Almost all three parts are over. Now in the fourth part we will see what exactly the minimal change in nephrotic syndrome is, which is very common in children. The minimal change in nephrotic syndrome is also called as idiopathic nephrotic syndrome. The cause remains unknown till today, although we attribute immunological factors for that. Immune suppression leads to rapid recovery. Now, one important thing is we don't know the cause actually. We don't know the cause why this particular proteinuria is happening, which is called as minimal nephrotic syndrome, minimal change. But surprisingly, if you give some immunosuppressants, for example steroids, which are immunosuppressants, if you give some of the immunosuppressants, then there will be rapid recovery in proteinuria. Proteinuria will get revert back within no time, maybe 1 or 2 days. The things are get reverted back after administration of the steroids. So after administration of steroids, when the things are reverted back so quickly, mostly we will attribute that to immune suppression. That means there is some exaggerated response is taking place, because of which this pathology is taking place. And once you give a drug like steroid, which is basically a immunosuppressive to some extent, along with potent anti-inflammatory effects, it is also immunosuppressive. So it controls the hyperreactivity of the immune system, and as a result the patient will be recovered. So this particular fact forces us to think about the immune cause for this particular proteinuria. So of course, immune suppressive drugs will also have other adverse effects apart from the immune suppression. We know that, but still, once you go for immunosuppression, the proteinuria will go into recover. So glomeruli appears normal, and there is only the minimal increase in the mesenchymal cells and matrix. So therefore, the name minimal change in nephrotic syndrome is also given. So this is important. Now, what is the diagnosis? Now, when you say that this is a case of nephrotic syndrome or nephrotic range of proteinuria, urine analysis, when you go for urine analysis, 3 plus or 4 plus for proteins. Then if there is microscopic hematuria, of course in the minimal nephrotic syndrome it is very rare. And in nephrotic syndrome the renal function may be normal or may be reduced. Okay, apart from this protein loss, most of the time in minimal change in nephrotic syndrome, all the other renal functions are normal, like urea, serum creatinine, everything is normal. Okay, maybe in the later stage they may get affected. Similarly, creatinine, etc. Serum cholesterol and triglycerides levels are raised. That's very important. Number one is there is a proteinuria. Number two is there is a hypercholesterolemia, or serum cholesterol and triglyceride level in the blood is increased. This is actually happening as a compensatory mechanism to protein loss. The protein has been lost, so now the liver convert so much of cholesterol in to produce cholesterol and fatty acids, fat and cholesterol, lipids will be converted into proteins. So in the process there is a release of so much of cholesterol which is depicted in the blood. Then serum albumin levels, if it is less than 2 grams per deciliter. In the blood, if serum albumin level is less than 2 grams or 2.5 grams per deciliter, that is also diagnostic. And total serum calcium levels also decrease. That's very important, because serum calcium level also going to increase because of the urinary problems. So these are some of the important points which help for the diagnosis of a minimal change in nephrotic syndrome. Number one is urine analysis. Number two is sometimes there is microscopic hematuria, very rare. Microscopic hematuria is important to differentiate the glomerulonephritis, okay, streptococcal glomerulonephritis, acute glomerulonephritis. Then renal functions, most of the time it is normal. Protein loss, yes, protein loss is there in the blood, so albumin level especially falls below 2 grams. Serum cholesterol in the blood level rise, and serum albumin in the blood is also decreased. Yes, total serum calcium may be also decreased. So these are the possible investigatory finding when you look into a case of a minimal change in nephrotic syndrome in the early stages. Once you start with any of the immunosuppressive drugs like steroids, within 3 or 4 days the patient will go to recover. And that made us to think about some of the immunological cause or autoimmune cause as a root cause for this problem. Now, if you look into the diagnosis further, children with the onset of nephrotic syndrome between the age of 1 to 8 years likely to have a steroid dependent nephrotic syndrome. Once you give the steroid, that will be corrected, but once you stop the steroids, the problems reoccurs. Okay, so we have to go for corticosteroids, which is usually given without any biopsy. In the initial stage, there is no need to go for the biopsy. But if the children is older than 8 years, if the children is older than 8 years, then instead of thinking about this minimal change in nephrotic syndrome, then we have to think about membranous and proliferative type of nephrotic syndrome. Okay, minimal change in nephrotic syndrome is usually common in the early part, 1 to 8 years. But if the onset of the nephrotic syndrome is in the later part of life, okay, older than the 8 years, then probably it is not minimal change in nephrotic syndrome, or rather we have to think about the other varieties of nephrotic syndrome, which comes under the primary nephrotic syndrome, like membranous and proliferative type of nephrotic syndrome has to be considered. So renal biopsy is needed for the firm diagnosis. So in the second case, when the nephrotic syndrome occurs after 8 years, before initiating any treatment, you have to go for renal biopsy. But in the first case, there is no much need of a renal biopsy. Now, how the pathology of this nephrotic syndrome develops, step by step we will understand, so that clinically there will not be any problem in diagnosing and there is no problem in the treatment. To ensure that we will go by step situation as a beginner, how you understand nephrotic syndrome. So we will go step by step in future. So that we will discuss in the next class. Thank you very much.